You're here for TB screening for?
My favorite part of working for the health department, I hold a role where I can help to promote change with patients, appreciate what we're doing for them, and that's what keeps you going for 25 years.
So have you ever had a skin test before?
I worked from 1973 to 2014. There was always something new happening at the Johnston County Health Department. We took care of each other and we looked out for each other. It is a very stressful job. It's not for the pay. It was like family working here.
It was just the cohesiveness of the group that we got along real well together.
We were able to help people that truly didn't have other resources.
But we get to make a good thing happen for them, sometimes in a bad situation.
Moving into the new building, I think, was one of the most positive changes that we had. It probably had some of the biggest impact. The old building was in much need of repair.
It was an old building.
Our ceiling used to leak, so when it rained, it poured, literally.
We covered our computers with plastic when we left if the rain was coming. We thought we were in the Taj Mahal when we got over here. And it will always be the new building, even though it's 20-something years old. The electronic record was a big change. It made a world of difference in being able to see patients and communicate and information. That was so many years ago. Some of us didn't know backspace from delete.
Everything was on paper.
It was change. Always something new. We didn't always like it. There wasn't such a thing as an iPad then.
We actually went to a workshop and we picked up our computer and brought it back to the office and set it up ourselves.
Good morning, Women's Health. How may I help you?
When I first started coming to work here, we would go out to the migrant camps and we would drive and we on these back roads back in the woods. So we would go do TB skin tests or we go to the field.
Socioeconomic level did not matter. A public health nurse was assigned to go there. Our patients didn't always have phones. They didn't have ways for us to get to them, so a lot of times one of our staff went out to their house to see them.
I don't think we could have dealt with COVID had we not had the number of staff that we have.
The epi clinic that's in this building, they were always prepared for something like COVID.
We're very proud of how we took on that challenge and what we did in terms of serving the public. But that'll be one of the things that I take with me in my career as something that was probably, as you said, one of the biggest challenges that we faced. And we conquered, I think.
I've always loved my job. I have become friends with some of my patients. Like say if they invite me to their baby showers or their weddings, and I've always been called a social butterfly.
First of all, I love being a nurse. We serve a lot of patients as our primary medical home. I do like going back to my roots where I get to actually talk to patients.
You have seen the county change so much in the 30 years that I've been here.
We offer a lot of services, more than what we used to.
Change in public health is slow, but it's solid.
So we have been around a long, long time. Our hats may be different, but our hearts are the same.